Yeah, it's still going now.
Yeah.
You want to just keep going, yeah.
Yeah. Direct feedback is obtained relating to the brochure content. No patient information publications created by the organisation were available. Next point is 2.4.2. Action is taken to incorporate consumer and or carers' feedback into publications prepared by the Health Service Organisation for distribution to patients. The Mackay United Women's Cultural Group, led by the Board of Directors Chair, has a guest speaker program that could provide the opportunity for ATSICHS to seek specific information as to reader-friendly publications for the community. Consumer information is generally provided for funded programs by the funder, and no in-house brochures were identified on site. Participants in Mackay United Women's Cultural Group and Tackling Indigenous Smoking Deadly Choices program provide feedback for reports that are incorporated into the ATSICHS annual report in 2016. So that was that one. The next one for me is 2.5. Partnering with consumers and or carers to design the way care is delivered to better meet patient needs and preferences. So 2.5.1, consumers and or carers participate in the design and redesign of health service.
And this is the
So
not
that's
met.
that's where we had the not met. So basically it was unable to confirm feedback through documented evidence or meetings. For the new cultural hub was implemented for the extended community to identify as a meeting place for all areas and all Indigenous cultures. So that was the one that we enabled with that car as well anyway, so that was a not met for me.
Yeah.
And my last one is 2.6, implementing training for clinical leaders, senior management and the workforce on the value of the ways to facilitate consumer engagement and how to create and sustain partnership. So under that there's 2.6.1, clinical leaders, senior managers and the workforce assess training on patient-centred care and the engagement of individuals in their care. So the findings for that, staff have access to ACSQHC and Queensland Health websites that provide information on patient-centred care. There are currently 6 primary healthcare staff participating in external primary healthcare courses that include patient-centred care. And then I have 2.6.2, consumers and or carers are involved in training the clinical workforce. As a result of the community concerns regarding increased incidents of suicide in 2015, ATSICHS became the lead agency in the prevention, post-prevention, intervention and immediate family support, the PPOO program. The program works in conjunction with Headspace. The SMO, the Senior Medical Officer, provides feedback to the group on a needs basis. Currently the groups are active in the prevention of ice addiction. The board chair is a cultural mentor and provides service to medical officers in training or qualified practitioners, internal and external, to the organisation.
Good.
Thank you.
Very good.
Okay. 2.7, informing consumers and or carers about the organisation's safety and quality performance in the format that can be understood and interpreted independently. 2.7.1. The community and consumers are provided with information that is meaningful and relevant on the organisation's safety and quality performance. Information is provided to the community through newsletters, website, Facebook and flyer notices. ATSIC's Mackay newsletter, March and June 2016, cited provide information on services in detail, all improvements achieved. For example, flu vac season. The annual report 2015 includes information from senior managers on each department and details the various community programs conducted by ATSICS. It also includes achievement of ISO 9001-2008 and NSQHS 2012 accreditation. 2.8. Consumers and or carers participating in the analysis of safety and quality performance, information and data, and the development and implementation of action plans. 2.8.1. Consumers and or carers participate in the analysis of organisational safety and quality performance. The board chair and directors are also consumers and carers in the community who access ATSICS services, either as patients or members of lifestyle groups such as women's groups. This allows for not only a board but consumer perspective for analysis of performance or organisational safety and quality. They are also empowered to capture feedback from other members of the community who may not be so forthcoming due to cultural norms. That's good, isn't it? 2.8.2 Consumers and or carers participate in the planning and implementation of quality improvements. Client satisfaction survey results and complaints have identified improvements to waiting times, transport booking schedule and employment of 3 GPs to improve patient access of preferred GP. This has informed the employment of more clinic staff and relocation of some services, for example social and emotional unit, to be more accessible to our building. 2.9 Consumers and or carers participating in the evaluation of patient feedback data and development of action plans. 2.9.1 Consumers and or carers participate in the evaluation of patient feedback data. The board chair and directors are also consumers and carers in the community who access ATSIC services, either as patients or members of lifestyle groups, such as the Women's Group. This allows for not only a board but consumer perspective for evaluation and feedback. They are also empowered to capture from other members of the community who may not be so forthcoming due to cultural norms. 2.9.2 Consumers and or carers participate in the implementation of quality activities relating to patient feedback data. Patients provide input as to service through the quick tap surveys, and 10% of clients are contacted by phone post-consultation to gain feedback. Loop surveys have also identified that more education was needed on healthy eating and lifestyle with consumers that has been incorporated in the Healthy Lifestyles programs. So that's why Shaz is so busy.
Okay, so that is the whole audit that we did on that standard. So if you've got any questions about what we just went over, let me know.
At this stage, no.
Okay. So you're happy with going ahead with the car?
Yes.
So we'll just reinforce that you'll have it done by the 28th of the 4th, and we'll do a follow-up on the 21st of the 4th to make sure you're on track.
Yep.
I don't think there's any other actions that we have unless you've got any feedback you want to give us.
At this stage, no.
Everything's good?
Seems great.
Okay, let's close this meeting. Thank you very much.
Thank you.
Thank you.
See you